Well, hi everyone. I'm Andy Asher, editor at Bloomer Boomer. Now let's say it like it is. You know, the unspoken mandate for senior workers today is bring your experience to work, but leave your wrinkles at the door. Well, it's a harsh thought, isn't it? But true. I think so anyway. There is a certain level of age discrimination among many organizations, some more tolerant than others. For many who feel the pressure of age discrimination in the workplace and others who just want to look younger are turning to cosmetic procedures to stave off the visual effects of growing old. Today we're talking to Beverly Hills cosmetic surgeon Dr. Behrooz Torkian of the famed Lasky Clinic, who has seen firsthand the growing trend of older people seeking cosmetic surgery to boost their self-confidence and their professional lives. Now, since early retirement is no longer an option for many in today's economy, many older people, even those in their 60s and 70s, still need to bring home the bacon. But competition from people 20 to 30 years their junior is stiff. As a result, cosmetic surgeons are seeing an uptick in senior patients who not only want to look younger, but need to look younger to be viable in the workplace. We're going to talk with Dr. Torkian in just a moment. Just want to let you know this is part of the Plus 50 Good Life movement. Now, this happens to be a project of the bloomerboomer.com publication where we bring stories and ideas from authors, from thought leaders, inspirational people. It's a movement for new and evolving things that make for a plus 55 and plus 50 good life. You know, the shows are about what's working and what's not and how to make the best of it. In the end, hopefully, something you can take away for yourself. Now, our guests are idea and thought leaders, experts, people with the experiences to emulate, folks with a unique expertise, or those that give us one of those aha moments or a revelation that can suddenly transform the complex and the bewildering into the understandable. So among those people we talk about is today's guest, Dr. Behrooz Torkian of the famed Lasky Clinic, has seen firsthand the growing trend of older people seeking cosmetic surgery. We'll be back with Dr. Torkian right after this. Well, Beverly Hills cosmetic surgeon Dr. Behrooz Torkian of the famed Lasky Clinic has seen firsthand the growing trend of older people seeking cosmetic surgery to boost their self-confidence and their professional lives. Doctor, thanks so much for joining us today. And, you know, it's a trend that I mentioned as we were just getting started, and that must be something you're seeing in your practice as well.
Thank you. It's an honor to be here again. Yes, it's not only something we're seeing in our practices now, but it's been around just probably now is catching a little bit more attention and a little bit more, I think, popularity, because instead of us offering it, it seems as though in the past it used to be something that a patient would come in for a facelift or a facial rejuvenation procedure, and we would offer them a conjunctive at the same time rhinoplasty technique to help to reverse some of the signs of aging in the nose. And it seems that now people are asking for it on their own and saying, hey, you know, my nose is drooping and it makes me feel old and it's going along with these sagging things over here. Is there a possibility that you can do all of it at the same time? One of the things that is really interesting, I think, about my practice is that in as you were saying, in not only in the workplace, but I think in the gym, and out on the track and out on the street where people are exercising, and those over 50 are continuing to stay fit and probably more fit than some people who are younger than them at this time. Are a lot of that population is now facing an issue that has to do with nasal aging, which is that if you notice, the nose sort of seems to shift down as we get older. I always tell my patients, after any kind of rhinoplasty in a young woman or a young man, I tell them, when you touch your nose after surgery, it's going to be more firm. And I'm doing that on purpose because I'd rather have it stay firm than to have it go down. And I said, if I didn't do that, then both of us will be like this by the time we get to our senior home. And we'll both have our noses down there. But at least if I make your nose a little stiffer, yours will stay up. Now, one of the things that goes on with that process of decreasing tip support and decreasing angle in the tip, as the angle goes down, That's happening because there's a weakness in the cartilage and the connections or junctions of the cartilage between the tip and the septum, or the tip and the skin, and the tip structures within themselves as well. And what ends up happening is that people's tip cartilages and sidewall cartilages get a little bit weaker. They're less supported. And as they're trying to breathe in, they feel a little bit more nasal obstruction. So this is something as the population, the fit population, the exercising population, and the gym crowd that's approaching their 50s or over 50 and approaching their 60s comes in, they say, I used to be able to breathe really well, but now, ever since my nose is growing, I can't breathe really well. So there's a couple of different aspects that I get to see in my practice that are really interesting.
That is interesting. And are you seeing work on the nose for people who are older more common nowadays?
Yes, and that's actually kind of an interesting newer development, I think, in my practice that I've seen over the past 12 years, is that instead of it being a cosmetic issue only, sometimes it is a functional issue that brings the patient in. And because of that functional issue, they get clued into their cosmetic issue. And because of that cosmetic issue on the nose, they're getting clued into the remainder of the cosmetic issues on their face, such as the drooping and the jowling. And so it's a newer sort of active senior population issue that we're seeing. And I think as the senior population continues to get more and more active and more fit, not only just in the workplace trying to stay competitive with the younger crowd in the workplace, but also in the gym and on the street and on the as they say, on the track. I think we're starting to see more and more of the functional issues take the forefront in the problems people complain about.
Well, that's interesting, and it's probably going to take a bit of research, because I don't know, maybe 12 years ago I had my eyelids worked on, and actually I got my insurance company paid for a large percentage of it, and I'm just thinking, well, I wonder if this might also be one of those that you get covered. I guess it's worth checking into, isn't it?
Well, yes, as the nasal examination is performed, a lot of times there are issues that come with the breathing along with cosmetic problems, issues that come with the nose that are uncovered that one doesn't really know about until it's examined. And upon further questioning, you might ask a patient, okay, so you told me that you have trouble breathing and it's getting worse, and you don't really like the way that your nose looks as it's drooping down and as you're aging and the nose looks longer and larger. Is there one side that's better than the other? And quite often there is. You might discover that there's a septum deviation. Is there a side that's better when you're breathing really, really deep, such as in yoga, that is normally okay? And quite often there is. And that's associated with what we call a valve collapse, which is where, if you can look from underneath, when a patient breathes in really deep, there's a closure of the valve area here, the sort of mobile area, this soft tissue in this area. And sometimes as the junctions between the skin and the cartilages get weaker, that gets worse. And so some people will say, I just can't breathe in deep during yoga anymore, and I have to do mouth breathing, which is really not the basic principles of yoga, as you know. So a lot of times we'll discover things like that may not necessarily be on one's mind as an insurance issue, but combined in a proper evaluation, you will notice that they can be an insurance applied issue. Usually the surgical aspects are separated. There's a cosmetic portion and an insurance portion, or a functional portion, that can be separated from each other. And if you have a doctor that accepts insurance, then you can usually apply those things to insurance where applicable.
Oh, good. I always felt a little bit uncomfortable asking questions about costs and so on, because I'm of a doctor. But I really appreciate you came around and explained that, and that's good to know, because a lot of times there's a lot of uncertainty out there, and
Right.
It's worth checking into.
Believe it or not, there's uncertainty within the medical population as well. Within my colleagues, some of them don't really understand the whole process, but you can separate, and should separate, we're expected to, functional and cosmetic portions. but we typically tend to lump them all in one. And if one were to lump, for example, a cosmetic surgery into an insurance case, that would be illegal. If one were to say, let's do this cosmetic case, and because you have breathing problems, I can fix them anyway, and the patient was paying out of pocket, that would be totally fine. Or, more realistically, if one has insurance that can cover it, and the patient and the doctor or the doctor's office is able to accept that insurance, then they can separate it. And there might be an hour or two of cosmetic work and 45 minutes to 2 hours of insurance work that can be done at the same time, but separated into two separate portions.
Wow, that's fascinating. When we talked last time, you mentioned to me that, and kind of in passing, really, but you mentioned to me that some people, or there are even options out there for Groupon to get Groupon discounts, which I found really that's 21st century stuff.
Yes, absolutely. I see it every day. I haven't seen specifically a nose aging procedure on a Groupon discount. Obviously, it's a little bit more of a niche technique and a niche procedure. And generally will come sometimes as a combination with a facelift or with an upper eyelid, lower eyelid procedure. But it's out there. I think in today's marketing environment, any means you can use to capture the attention of a certain population, you will use. And that's what a lot of practices in the area do. Usually younger doctors, but what I've noticed is that Groupon has changed a little bit in terms of the kind of response that you can expect from it. I've never done it myself, but I've watched, I know friends of mine who do it, and recently I asked a friend of mine who's a younger doctor who did a Groupon advertisement for Botox, for example. I said, how did it go for you? And he said, I don't think it really worked out as well as I expected or imagined. And I said, why do you think that is? And he said, just like any other advertising principle, it's repetitive exposure. And if you just had one exposure or two exposures, you may not get as much of a return on your investment. But with multiple exposures and continual or follow-up advertising, you might get a better response. And so a lot of times we're seeing people start out with things like Groupon because it reaches the target population as a push rather than as something the target population has to go look for, if that makes any sense. But it reaches the target population on their email, they open it, and it's a splattering of different things, from spas, advertising massages, to Groupon Goods, which advertises clothing and underwear and pajamas, and so on, to doctors advertising their Botox in their practices. It's kind of a neat thing, but it gets pushed to people. So they see it on their email, and the exposure is pretty quick. So you get to have a large amount of exposure with a large number of people looking at your name and at your advertisement, and then you repeat it, and then you repeat it, and that ends up working for people.
And maybe in referring to the push part of it, it works when folks are glancing through a magazine or online somewhere, and they see that offer, and they realize that in the back of their mind they can actually get some cosmetic surgery through Groupon, and cosmetic surgery they may have put off or thought that they was out of reach. So there's a definite benefit there, I think.
For sure. The industry is growing because of these types of exposures, for sure. I absolutely agree. If we didn't have these types of exposures, if we didn't have the Groupons, if we didn't have the advertisements happening, the entire industry would have stayed a little bit more stagnant. And as you know, by looking at statistical trends from the American Academy of Facial Plastic Surgery and the American Academy of Plastic Surgery, or the ASAPS group, a lot of times the speed of growth or the rate of growth of the procedures is more rapid than you would expect, and we can't really figure out why. It's not like there's that many more people in the world. It's just that now we're making people aware of it, and it's okay. It's more okay than it used to be.
Yeah, too, and I'm thinking that it's on the very topic that we're talking about today, or the focus of it has to do with older people looking at that as an option. I mean, I tell a story when I was at a gathering with friends, and to talk about just anything light, I guess. I asked what's most important to a friend of mine, and he said Social Security and how he looks. So and I'm not sure. I think he's probably in his 70s, maybe, and so it does show you that those are a priority, and they don't go away just because you have a little age on you.
Yes, absolutely. Absolutely, I totally agree.
And so I think when we talked before, you had mentioned it's not totally uncommon to see patients in their 80s coming in there to see you.
Oh yes, I have a patient who adopted me as her adopted grandson. She is a lovely woman in her 80s who came in and said, I need Botox. And I said, are you sure? And she said, I get it every 4 months. I said, how did you find me? She said, my friend told me about you, and I came to see you. And, I think it's great. She looks wonderful. She's been able to maintain and prevent and makes her feel good about herself. And, one of the things that we don't often talk about but is gaining a little bit of interest and popularity now is the not visible or invisible effects of Botox. As an anti-aging treatment, you can see the lines get better and you can see that there's prevention occurring. But Botox really makes people feel better. And there's a couple of different studies out there. One that is a psychiatry study that discusses how Botox in the glabella area, right here in the middle, which is the first place it got FDA approved for in cosmetic use, can actually reduce depression. And it helps people reverse depression sometimes or need less antidepressive medications. Another really neat benefit is that Botox in the forehead for cosmetic purposes has also been indicated to reduce the frequency of migraine headaches, which can be a tremendous problem that can lead to depression and anxiety and so much discomfort in so many people. And so, one of the things that I think sometimes brings people back in is maybe they don't notice it, maybe they don't realize it. They look better, they feel better about themselves, but they also feel better inside as well.
That's really important. That's that's so important, if not one of the most important. Dr. Torkian, I know you're running up against the clock. There are a lot of other things I wanted to talk to you about, but we'll maybe do that next time. And again, I thank you so much for the time.
I hope we can get together again one more time. And when we talk about the aging nose, one detail that I was kind of hoping we could cover, we haven't covered yet. Again, it's a growth process that appears to be growth, but is a weakening of the cartilages and is reversible with a rhinoplasty procedure. So if we get to that topic a little bit more detail next time, that would be awesome.
Absolutely. Okay, well, I'll write that down. Well, again, have a good rest of your day, and thank you so much. Thanks again. That's Beverly Hills cosmetic surgeon Dr. Behrooz Torkian of the famed Lasky Clinic. We'll be right back. Well, that wraps it up. I hope you liked the show and learned a thing or two. The full show will be available on YouTube and at Bloomer Boomer. And the audio version will be available on Apple Podcasts. And we have other shows coming up with some amazing guests. Please like us on Facebook and visit us at bloomerboomer.com. Have a great day. So long.